Good evening and welcome to Conversations Live, Ask the Veterinarians. I'm Patty Satalia. Some of the most powerful and remarkable connections we experience as humans are the unbreakable bonds with our pets, whether it's furred, feathered, or scaly, in the backyard or on the farm. They all need proper care. Tonight, our guests will discuss ways we can keep our large and small animals healthy and happy. They'll also take your questions. Our toll-free number is 1-800-543-8242, and our email address is connect@wpsu.org. If you'd like to join us on Twitter, you can tweet a question to @WPSU. Now let's meet our guest. Dr. Ellen Scholz practices at All Creatures Veterinary Care in Center Hall, where she treats cats and dogs as well as exotic pets. Dr. David Wolfgang is the Director of Field Investigations and an Extension Veterinarian in the Department of Veterinary and Biomedical Sciences at Penn State. Among other things, his work focuses on animal well-being and preventative health programs for livestock. Thank you both so much for joining us.
Thank you.
Let's begin by talking about the pressing issues or the top concerns you're seeing in your practices right now. We'll begin with you, Dr. Scholz.
Well, one of the really big emerging diseases that we've seen is the presence of Lyme disease in our community. And I think we've seen a great surge in the number of ticks infecting the pets, and Lyme disease has followed very quickly. Dogs, of course, tend to be more apt to get the ticks, and the symptoms can be very difficult to pick up initially. The classic symptoms are fever, lethargy, they're tired, they're achy, they don't even want to get up, they're so painful. But we've seen very subtle symptoms as well, limping, being off their food for a while. So it's definitely something that we're seeing much more now.
I know my vet encouraged me to have my dog vaccinated against Lyme disease. What can you tell us about that vaccine? Is it working?
It's the best we have. You know, Lyme disease is caused by a bacterial infection, and vaccines against bacterial infections don't seem to be as effective as vaccines against viral infections. But at this point, it's the best thing we have, so we are definitely recommending it for our patients.
Okay, I have some other questions about Lyme disease, but I'll come back to you. What's happening in your practice?
Well, again, I think the largest issue that I see right now for livestock is some of the welfare concerns that we have in our livestock species. And this crosses equines, horses, sheep and goats, cattle, even the swine industry and poultry. And many consumers, as they see images on TV at times or see reports, are concerned about the conditions under which animals are raised. And one of the challenges we have is to modernize our farms, improve efficiency, at the same time ensure that every animal on the farm has a good quality of life. And that's a challenge right now.
Yeah, the bottom line is often tight. And today we're able to raise more animals with fewer people and on smaller acreage. So you're saying that balance can be reached?
Yeah, well, it can be reached. And what we certainly encourage people to look at their farm system, so that the environment the animals live in is high quality, but at the same time we minimize the impact on the environment. Some of these systems that are very extensive, where the animals have lots of space, actually have a bigger environmental impact. And we're trying to look at cost-efficient ways to maximize the health of the animals, their productivity, and minimize the impact on the environment. At the same time, maintain high quality and safe foods. And so that's sometimes, you can do it, and if you do it properly, it can be somewhat of a win-win-win situation where farmers can experience good productivity and profitability, consumers get a very high-quality product that's safe, and at the same time, the animals have a good quality of life.
As you said, consumers are more concerned these days about how their food is raised, and the result of that is that more and more consumers are raising their own chickens, for example, whether they live in urban areas or rural areas. What can you tell us about what's required to do that safely and to do it well?
Well, one of the challenges with raising your own livestock is, can you provide them an environment and a diet that's adequate? And that gets to be a challenge sometimes for people who have not been raised on a farm or don't have a good knowledge base. And so there's no reason that in certain circumstances these smaller operations can't work well, but I encourage people to spend time learning about the animal or the bird, their nutrient requirements, sort of their husbandry requirements. Learn all that before you get the animal, so that then they have a healthy animal that they can raise properly. so often we get, and I'm sure Dr. Scholz has the same problem, people get the pet and then they do the research. We'd strongly encourage you, do the research first, understand what you need to do to provide a good environment for them, because once you take ownership of them, you're responsible for them to provide that environment and that diet for them. So if you fail to do that, whether you mean to or not, it's not fair to the animal. So please do the research first.
Well, that's really an excellent point, because pot-bellied pigs, for example, were all the rage a few years ago. Now these teacup animals, pets, are the rage. I don't know how much you're seeing them around here, but what kinds of problems in terms of mismatches between the kinds of animals that make good pets and don't are you experiencing or dealing with it in your practice?
Well, I agree. Because an animal is cute doesn't mean it's going to be a good pet. A pig is a pig is a pig, and a teacup pig, even though it's small, is still a farm animal. Housebreaking can be an issue. They need space. They need fresh air. There's a lot of odor associated with them, and you know, that cute little pig, if it's not fed properly, and actually they have to be very calorie restricted to stay so small, they can get very large, very obese, and people have a lot more than they expected.
You mentioned obesity, and obesity is a problem in the human population, but it's apparently a growing population among pets, not just pets, but among animals in the wild. I'll begin with you, Dr. Scholz, to address obesity among pets. How big a problem is it?
It's no pun intended, huge. There's a couple reasons, I think. One is our foods for pets have become incredibly complete and incredibly palatable. So the animals want to eat them, and they want to eat a lot of them. People often mistake food seeking as hunger. And so when those big brown eyes are on you, you think, oh, you must be hungry. So they'll feed them more. Also, I think as we are busier, a lack of exercise is a huge component as well. We're tending to keep kitties indoors now, which is important that it's safer for the kitties and safer for the environment, but they aren't getting as much activity. Dogs are being allowed out in the yard, but they're not getting the long walks. And these are animals that were meant to walk all day long. So they're not burning as many calories either.
I was reading and was really surprised, because I'm sometimes guilty of feeding table scraps to my pet, thinking this was good for me, it's also good for my pet. And then I read about high fat and sharing Thanksgiving dinner, for example, with a pet, and the risk of pancreatitis. Explain that, because after reading it, I thought I'll never give table scraps again.
We used to call the day after Thanksgiving Pancreatitis Day. The pancreas is an organ that secretes digestive enzymes. Eating fats will trigger the secretion of these enzymes. And so in an animal, and some are more sensitive than others, that is overfed fats, the organ literally over-secretes, becomes inflamed, and starts leaking these digestive enzymes, and literally the pancreas starts digesting itself. The animals are very painful in the abdomen. They'll start vomiting, and they can even die from it. Animals that do recover from a serious pancreatitis can develop diabetes, because the pancreas also makes insulin, which is important to regulate sugar.
Wow. I think just knowing that may reduce the number of Thanksgiving visits you have to your clinic. Obesity, though, among domesticated animals, is it a problem there as well?
Well, it follows some of the same problems that Dr. Scholz outlined in our pets. We often put animals in a very restricted environment, horses, rather than wandering over hundreds of acres to find sparse pasture. We put them in the pasture and give them lots of grain, lots of hay. So we have obesity problems in horses. We have obesity problems with their sheep and goats. Animals that don't work very hard tend to gain weight. So sows that are, while they're waiting to have their young in the gestation phases, they can be overeat. There's such a drive in our animals to eat. And again, as you described, we have diets that are really well balanced. And so it's actually easy to overfeed animals today. And so restricting calories or putting more fiber in the diet are strategies that people need to do to maintain healthy animals, just like we need the same sorts of restrictions sometimes in our own diet.
Just picking out a pet food, whether it's your cat or your dog, by the way, can be absolutely overwhelming. You go to the grocery store, there's an entire aisle that's dedicated to that, and then there's all kinds of information out there about things like the Barf Diet, for example, the biologically appropriate raw foods diet, which basically means bones and raw food. Is that a fad, and what should we look for in a commercial food product if that's what we're going to use?
Sure. Well, first of all, about the Barf Diet, I was very skeptical because as a scientist, I worry about salmonella and contaminations when you're feeding raw foods and whole foods to animals. I've seen so many animals sick with bones. After seeing well-fed animals, and this is a difficult diet to do correctly, and nobody should attempt to do it unless they have done their homework first. But the animals on the raw diets seem to be doing very well. Their teeth are very clean. I've actually become a fan of them, but they take time, effort, and they're expensive. My own pets are on a kibble diet because I don't have the time to do an appropriate raw diet.
Okay, so what do you look for in the food label if it's a kibble diet?
Most foods are balanced, and there are USDA labeling for them that are balanced and completely nutritious for the animal. The difference in the prices, I think, depends on the different sources of proteins and carbohydrates. The more meat-based a product, probably the better bioavailability. It's easier for the animal to use that protein.
So if grain's first listed on the package, maybe bypass that one?
Or other protein sources, like there was the big problem with gluten, and in China they had added some melamine to increase the protein content, which made a lot of animals sick. So they also use plant-based proteins to increase that percentage of protein, but we're feeding carnivores in dogs and cats, and so their bodies aren't really set up to metabolize those plant-based proteins as well.
Okay. All right, we go to our first caller. Donna is calling us from Mifflin County. Go ahead, please, Donna. You're on the air.
Okay, yes. I have a Chihuahua, and he is chewing his back 2 feet, licking and chewing, and they're real red and they're real close to bleeding. Could that be a food allergy? Or is it like the allergy the time of the year, something in the grass? I have not changed any of his food, so I just don't know what that is.
How old is your dog?
He'll be 2 in January. No, 3. I'm sorry, 3.
Well, it certainly could be. Dave and I work together in a mixed practice, so I know you know a lot about small animals as well, but any new itching, especially consistent itching in one location, is totally consistent with allergies. Dogs and cats can be allergic to whatever we're allergic to, but it usually takes a year or 2 for their bodies to be sensitized. So 2 to 4 years is a very common time for allergies to show up. Unfortunately, when they get itchy, they will chew until their skin is raw and their skin becomes infected, and then you're dealing with an itchy infection on top of an itchy allergy. So it can be a little difficult, and you have to start working with the animal to clear up the infection before you can start to find out what it's allergic to. But food allergies are definitely possibilities.
And what would you do for a food allergy? Would Benadryl work for a pet, for example? And in a Chihuahua, which is so tiny, dosage would be important.
Medications don't generally help with food allergies. They do seem to help with environmental allergies like pollens, dusts, and molds. Food allergies, we usually do an elimination diet. Years and years ago, when Dave and I were in vet school, the elimination diets were a lamb and rice-based diet because no pet foods had lamb or rice in them. Unfortunately, somehow that got translated to lamb and rice being good for the skin, and now you'll see tons of pet foods out there with lamb and rice. So the newer elimination diets are, we call them novel proteins, a protein they've never had before. And they're odd things like fish and potato is very common now, duck and pea, so a different protein and a different carbohydrate source.
So the bottom line is she needs to go out and try a new dog food.
Well, I would first say she should probably have the dog checked by her veterinarian to make sure the infection has been cleared up before you can even start to deal with the allergy.
Okay, anything to add, Dr. Wolfgang?
No, I think a good diagnosis, because if you're chasing food allergies when it's actually a pollen allergy, you're not going to get to the root of the problem.
Okay. One thing I think a lot of people are curious about, and I guess I'll call it dietary indiscretions on the part of dogs or cats, and that is eating very unusual things. For instance, dogs eating grass or even used kitty litter. Yeah. Why do they do that? Is it harmful? And is it a sign maybe of some deficiency? Dr. Scholz.
Oh, you can have that one, yeah.
I always say, a dog is a dog is a dog. This is not a sign of a nutritional imbalance. This is a sign that you have a dog in your house. Dogs will eat anything. You know, their sense of smell is their primary sense, so taste is a secondary to them. We know that cat feces is very high in protein, so we call them litter fritters. Dogs are actually attracted to eat the cat feces, which is why they're going for it. They're not trying to gross you out or piss off the cat. They just want to eat them. And I think that's what happens with most dietary indiscretions. In rare cases where there are deficiency, we'll see things called pica, animals that will lick non-food items, which you probably see more in large animal practice than I do.
Yeah, there can be deficiencies, and sometimes they'll seek soil as a way of finding salt or sometimes phosphorus. We see that. The other thing we see occasionally with animals is if they're bored, and that's what we call stereotypical behavior. So some animals will chew on odd things, like some people chew on their fingernails or do other things, but animals will often have these odd habits that they develop sometimes when they're bored.
And perhaps if they're stressed.
If they're stressed, that would make it worse.
Okay. If you're just joining us, I'm Patty Satalia, and this is Conversations Live. Ask the Veterinarians on WPSU TV and WPSU FM. Let me reintroduce our guest. Dr. Ellen Scholz practices at All Creatures Veterinary Care in Center Hall, where she treats cats and dogs as well as exotic pets. Dr. David Wolfgang is the Director of Field Investigations and an Extension Veterinarian in the Department of Veterinary and Biomedical Sciences at Penn State. Among other things, his work focuses on animal well-being and preventative health programs for livestock. Our telephone number is 1-800-543-8242, and our panelists are ready to take your call. You can also email your question to connect@wpsu.org, or if you'd like to join us on Twitter, you can tweet a question to @WPSU. Let's talk a little bit about immunizations. We'll begin on the farm.
Okay.
What's required by law? Because so many people these days, we mentioned that they're raising chickens, but they're also raising a couple of goats, a couple of sheep. I mean, this is more and more something we're seeing more and more of. Talk a little bit about, you know, when a veterinarian is needed on the farm, for especially a small someone just getting into it.
Well, again, we certainly advocate strongly that people develop preventative health programs for their pets or their livestock. And so we would rather prevent disease or prevent injuries as opposed to treating them. And that's sometimes a little different mindset. We certainly could argue that's what we should have a mindset in human medicine, but we certainly advocate that very strongly in veterinary medicine. So I think people need to get animals that they can handle, because there's some challenges with animals as far as fencing and maintaining them, and they have adequate access to diet. And then beyond that, as far as diseases go, there are a few infectious diseases that animals transfer between members of the same species. So there are some sheep vaccines and some goat vaccines and some horse vaccines that are semi-ubiquitous. Things like tetanus, lots of those species get tetanus very easily, and that's in the environment, in the soil. Sometimes there's other respiratory disease, depending on where if they're going to shows or if they're going to stay in
Number
big
of kids
herd flocks.
got swine flu at
We like to call that a variant flu.
Okay.
It did happen. The pigs were a little bit sick in Indiana.
Indiana County. So
No, Indiana.
Okay.
The state of Indiana, the same strain. We're not exactly sure why the virus has popped up in a few other states. In Huntington, at that fair, some children got sick with an H3N2 type of influenza virus. But the pigs, as far as we know, they were sampled and they were checked and they didn't have a fever, they weren't sick. And so it was a subclinical carrier in their state. So we don't normally vaccinate pigs for influenza, although occasionally there are strains of influenza that can leave pigs and make people sick. And there have been several cases where kids have had influenza viruses and shared them with the pigs. And so lots of our species do get influenza vaccines, horses, and now we have a new strain of influenza in dogs, and we have issues with influenza in poultry. But most of our animals have somewhat species-specific diseases. So there are a few that transfer between, like cattle and sheep and goats and deer, something like bovine virus diarrhea. That's a virus that can cross species, but we usually encourage people to look at their species, and the risk. And so some diseases like rabies might be something that lots of species need to be protected for. But in general, they're fairly species specific for vaccines.
We're going to take a phone call in just a moment, but he just mentioned, Dr. Wolfgang mentioned rabies. Lots of people who own indoor cats say, why do I need a rabies shot? My cat's an indoor cat.
Well, rabies is the only vaccine required for pets in Pennsylvania. The only cats that are exempt, unfortunately, are barn cats because farmers felt they were partially wild and they wouldn't be able to catch them. What I tell my clients is rabies is for your protection as much as the pets. Both for you, you know, you never know if an animal could get into your house with an indoor cat.
For example.
Or a bat, exactly. Or if your pet should scratch or bite somebody visiting, you have that legal protection that your animal's been vaccinated and can't carry rabies.
Okay, we go to John, who's calling us from State College. Go ahead, please, John.
Hi, thank you for taking my call. We had a scenario with our very active, happy yellow Labrador a couple years ago where he got into an entire pack of gum that contained xylitol, which is always a fun treat. Had I not found the wrapper on the floor of our garage that had been partially chewed for the box, I don't think we would have known that he had ingested that. But I was hoping the veterinarians could kind of discuss xylitol and foods containing xylitol, as well as obviously chewing gum, and how parents can probably act a little bit more carefully when kids are handling gum, not to leave it in places where dogs can get it.
Wow.
Absolutely.
Dr. Scholz.
Yeah, xylitol is an artificial sweetener used in gums as well as many of the sugar-free foods made for diabetic people. And it's extremely toxic. It doesn't take much to make a dog very sick. It causes liver disease and liver failure, and I've seen animals die from very small amounts of it.
Wow. The dose makes the poison, and we've heard a lot about things that I didn't know were harmful to pets. Grapes, harmful to dogs?
That's interesting because there's some controversy. A couple years ago, I have two of the baddest dogs in America, and they ate 2 pounds of raisins. They took a whole bag off the counter and ate them, and 3 days later, I'm like, they're probably toxic. And my dogs were fine. It seems, and we're not sure, one theory is there's a mold on the grape or raisin that certain dogs are sensitive to. The dogs that appear to be sensitive, it takes very few and it affects their kidneys, and they'll go into kidney failure very quickly. Animals that are not sensitive to it don't seem to be bothered at all. But it is definitely, I tell people, we were never taught about grapes and raisins in vet school. I tell everyone, just don't take a chance. You know, it's not a pet-friendly food.
As the caller just, with the dog that got into chewing gum, that dog probably ate the packaging, the plastic cellophane, and how big a problem does that present?
Depends on the amount of packaging, the texture, and the size of the dog. It's only a problem. Anything that passes through is not a problem. It's things that don't pass through that is the problem, and how irritating they are to the intestine.
Okay. We go to Carolyn. She's calling us from Bedford. Carolyn, you're on the air.
Thank you. I have a 6-year-old orange tabby, and he's been diagnosed supposedly with acid reflux. We're not really getting any place with what they advise, Pepsid broken in half, people medicine dissolved and given to him, and it does not seem to be helping him. Do you guys have any suggestions, please?
How old is your kitty and what symptoms is he having?
Okay, he'll maybe about once a week. For a while, he was doing projectile vomiting. And he is 6 years old.
And how long has he been doing this?
Since, I would say for about 2 months now.
Okay.
After a $200 vet bill, which did little.
Well, it really depends. Vomiting is a pretty non-specific symptom. Is he losing weight as well?
No, ma'am, he's not. He was, but we changed his food. He's an indoor cat, and he was doing good for a while, but he's also a nervous Nelly.
Well, again, vomiting and projectile vomiting, if he's not losing weight, it means he's getting plenty of nutrition and enough to maintain his weight. So I'd be concerned. There's functional causes of vomiting. Does he have an obstruction? Sometimes the muscle at the
I x-rayed him,
bottom. And there's no obstruction,
and this is what they diagnosed him with.
did they do an endoscopy where they put an endoscope down and looked at his stomach and his...
No, ma'am. No, ma'am.
So, unfortunately, it seems like his symptoms are difficult enough that he would probably need some pretty sophisticated diagnostic testing to find out acid reflux means that stomach acid is splashing up into the esophagus, or the tube from the mouth to the stomach, but it doesn't really tell you why. And Pepcid is a very good treatment to decrease the acid, but I think more diagnostics seem to need to be done to find out why that acid is refluxing.
Would homeopathic medicines help him?
I'm not an expert on homeopathy, but I think until you get a good diagnosis of what the problem is, no medicine's going to work.
She mentioned that her cat's a nervous Nelly, and
Oh, he's a scaredy cat.
and there are apparently cats and dogs that take Prozac.
I think he is a candidate.
and yeah, the anxieties can cause gastrointestinal disorders. We also see inflammatory bowel disease in cats, like Crohn's disease, which can be aggravated by stress and anxiety as well. Again, it sounds like he has one of the less common problems, which means more sophisticated diagnostics need to be done, even as far as taking biopsies of the stomach and intestine.
Okay, well, thank you so much.
Sure.
Yeah, and I think that's the challenge. Sometimes in animal medicine, people want a quick diagnosis, and sometimes, although you spent $200 for a diagnostic workup, which is a lot, that might be just a fraction to actually find. So sometimes veterinarians feel compelled to sort of balance cost-effective diagnostics with some symptomatic therapy to see if the animal gets better. But I agree with Dr. Scholz that this could be a very complicated diagnostics, and very sophisticated techniques might be necessary to actually rule out or in exactly what is the problem.
I hate to push pills, but would Prozac be maybe something to try before the additional diagnostics?
There's so many different side effects, and behavioral medications are very effective in animals, but we have to know what we're treating before we use them, because if used inappropriately, they can make things worse.
Okay, good point. We go to Mary, who's calling us from Falling Timber. Where is Falling Timber?
That's near Prince Woodson State Park.
Oh, okay. All right, go ahead. What's your question, please?
I just was wondering, my son-in-law has a large dog. He's about 8 years old. And recently they said the dog was having some heart problems. The leg and shoulder, everything swelled up. So it's on Lasix and some other medicine. And now, is there anywhere that could that take either low payments or can get financial help or some type of help? Because he's not working, he's on Social Security. And he doesn't want to give up, put the dog down. He would rather, keep his dog, but he needs help financially because he can't afford what they charge. It was $140 just to find out what was wrong with him and some of the medicine.
I saw a website the other day. I've never tried it, but it was called FACE, and it was to help people in the situation you're describing, FACE. FACE may be worth looking into, but can you add anything to that?
Do you want to take this one?
Well, I can start on that. There actually is a fund, the Veterinary Foundation has the TLC, the Last Chance Fund, which we've been working on as a foundation. It's a 501c3, so it's a tax exempt. But the Veterinary Foundation is administered by the Pennsylvania Veterinary Medical Association. It's independent of them, but they actually have several $100,000 in there, but they distribute funds to help veterinarians defray their costs. And one of the challenges when you have sophisticated medicines and sophisticated diagnostics, the veterinarians' costs are not a whole lot different in some respects than the same diagnostics or same medicines for humans, with and less opportunity to supplement that income. So,
and no Medicaid.
No Medicaid, and so
insurance.
That's a real challenge because the medicines cost a lot of money. But this Last Chance Fund, and there is a website, Pennsylvania Foundation. I can't give you all the, but if you just Googled Pennsylvania Foundation, the Last Chance Fund, What that does is that provides the veterinarian with his fixed cost, so that they doesn't pay for their time, but it is an opportunity if they apply for that to use the funds from that to pay for the fixed cost, the fluids, the medicines, and things like that, the stuff that's out of pocket, so that if the veterinarian would choose to donate, or he or she would choose to donate some of their time, they can defray some of the fixed cost for conditions like that, or hit by car accidents where people may get an unusually large bill.
Okay, and then are you aware of anything else, Dr. Scholz?
Well, I know, this is a big problem. As Dave said, as we get more advanced, we are using human machinery, human medications, and the costs are skyrocketing for us as well as for human medicine, and it becomes a difficult choice. Often we have to make economic choices, which are very, very hard. I do know that some of the local nonprofit humane groups do offer payments to help defray costs as well, and you may contact some of your local groups as well and see if they can help. But this is a difficult problem.
That's interesting, because oftentimes a pet in this situation might be dropped off at an SPCA, and for the SPCA, it may be more cost effective to help this person keep and care for their animal.
Yes.
So we go now to Nancy. Nancy, who's calling us from McAlevy's Fort. Go ahead, please, Nancy.
Hi, thank you for taking my call. I'm calling about fleas.
What do you want to know about fleas?
I want to know how I can get them under control. I've tried Frontline, all different kinds of shampoos. Oh, so many things that I just cannot get them under control.
How many pets do you have?
I have a Yorkie inside and 2 cats.
Oh, boy.
And are there any feral cats outside? Do you have extra cats that you feed?
No.
Okay.
Cats go inside, outside.
Yeah. Fleas are really tough, and I found that it seems like different homes and different pets have more susceptibility to fleas.
To you?
Yes, you may hang up. That'd be fine.
Thank you.
Thank you for your call.
Thank you. Different pets and different homes have more susceptibility to fleas. Fleas actually will hatch based on humidity, not temperature, which is why even in a heated home in wintertime, the fleas often die out. And you think, oh, I've got the problem solved, and then a nice moist April rolls around, and by May you're infested with fleas again. So it's important to understand that you have to take a multi-layered approach to killing fleas. Fleas feed on the animals, and they do drink blood, but then they drop off the animals and lay their eggs in the environment, which unfortunately is your house, your carpet, your furniture. So if you're having a real problem dealing with fleas, it may be that your house is a little moister and the fleas hatch more readily, which means it's not that you're doing anything wrong. You have to work a little harder to get rid of the fleas. So we definitely recommend treating the pets. And shampoos are good for killing fleas on the pets, but they have no residual. So the minute you rinse that shampoo off, the fleas in the environment can jump right back. And that's why we recommend the residual products like the spot-ons, like Frontline and Advantage, that have a long-term killing effect on the animals. But I think it's also important to remember you need to treat the environment to get the source of those hatching eggs. And often you have to treat it multiple times because nothing seems to kill the eggs. And so what we're doing is trying to kill the new larvae that are emerging.
We talked about this a little bit earlier. The Natural Resources Defense Council recommends that people use pills for their pets rather than a collar. The collar, they say, can actually transfer pesticides to small children who are petting their dog or cat. You say it's a trade-off. Explain what you meant, Dr. Wolfgang.
Well, yeah, there's no doubt that, yes, if children actually hug the dog or get a lot of contact with the flea collar, they can get some of that on them. And that can be a problem. I usually like flea collars sometimes for dogs that are going out in the brush, hiking or maybe hunting, where they actually maybe have a lot of exposure around their head, and then you could take the flea collar off and get back home. Some flea collars don't work very well with some of the other products, or actually shouldn't be used with some of the other products, like Frontline or Advantage. And some animals...
Why? Because it's too much?
Well, it might be too much. Yeah, it's accumulated dose. And then some animals are very sensitive to them, and some of the products just appear to be more irritating than others. So you have to sort of pick and choose that. As Dr. Scholz mentioned, treating fleas or ticks is usually a multifaceted approach. You have to look at where the animals are in the environment, how many insects are being exposed to, and then can you minimize that exposure, and then what can you do to keep the ticks or fleas off the pets? And it usually requires two or three strategies to be effective.
And as you said, you have to eliminate them from the home, or your dog's just going to, or cat is going to just keep on getting them. Would home fumigation work? Is that something you would advise for
There's
fleas?
lots of different ways, you know. It depends on your tolerance for chemicals in the household and your tolerance for fleas in the household, basically. You know, probably the easiest way is to call an exterminator to come in and do a routine exterminating. You can also use the chemicals in the home yourself. Foggers will spray the entire house, although fleas tend to live from 3 feet down. Yeah. So I actually prefer the carpet sprays because you can direct where the spray's going, and you don't have to worry about what's going up into your dishes and your food. There are a few natural products that people have tried and have found to be somewhat effective. Putting diatomaceous earth in the carpeting will help kill the larvae as they hatch out.
Anyone who has a swimming pool knows what diatomaceous earth is.
And organic farmers know about it. Definitely you want to launder all the bedding through the washer and dryer, and that will kill fleas in the bedding. But again, one treatment is not going to fix it. It's going to take a number of treatments.
All right. Thank you for that phone call. We go to Penny, who's calling us from Frenchville. Are you with us, Penny?
Yes, I am. My husband has a 2-year-old Jersey heifer, and she was going across in the pasture, and she went down, and she died. And my husband wanted to know if she had a heart attack or what.
That's a tough one.
That's a tough one.
Yeah.
Well,
there was, you know, she wasn't around anything. She's eating grass and hay. That's it.
Yeah. Did you actually see the animal go down, or did she?
Yes, I did.
Well, that would be unusual. Something very traumatic. Occasionally, again, at this point, it's mostly speculation on my part. A 2-year-old animal should be fairly healthy and do well. You'd have to be speculate. They do get aneurysms, not so much heart attacks, but it's not uncommon for Jerseys to actually get some aneurysms and actually have a large blood vessel actually burst. And I guess in the future, if you have more animals and you have an animal that dies suddenly, I would encourage you to get that animal examined by a veterinarian. They do a necropsy, sort of like an autopsy, we call it necropsy in animals, to try to find out why that animal would die suddenly, so that if you would get a second animal or a third animal, if there was something unusual in the environment that would cause it, we would prevent that from happening to the other animal.
How much would something like that cost?
Well, again, in Frenchville, you have a relatively large trip fee because I don't think there's very large animal veterinarians close to Frenchville. So there would be some time to drive out there. Actually, the diagnostic lab here on campus.
The vet would go to Frenchville for this?
Well, I would recommend that because it'd probably be more cost effective to go to Frenchville than to bring the animal on the back of a truck or something. But the diagnostic laboratory here at Penn State actually does autopsies on animals, and I think the large animal autopsy is $65. It's not really very much. That's partly subsidized by state dollars, and so for livestock, that is a way to help get some information about why animals die.
Okay, and where do they call? What department is this?
Well, it's actually a diagnostic laboratory here at Penn State, 865
That's what it's called, the diagnostic laboratory.
Animal Diagnostic Laboratory.
I didn't know that was the actual name for it.
Yeah, believe it or not, that's the actual name.
All right. We have an email from Patty. She says, have you ever heard of bug snapping syndrome? My Bernice has had it since she was a pup, and I'm not even sure I'm pronouncing the breed properly. She has been on phenobarbital and potassium bromide. I just wonder if there is any other treatment for this syndrome. Thank you. So you'll have to begin by telling us, what is that syndrome?
It's a neurologic problem where they randomly bite at the ears. From what I'm not real familiar with it because it's not very common, but the drugs that your pet is on are drugs to treat epilepsy, so I'm sure they're considering it a seizure-type disorder, but unfortunately I'm not real familiar with that. I don't know if you have any more to add.
No, I'm sure it's an epileptic type of thing, and that's what they're trying to treat.
And the medicines she's using, are they expensive? Can you imagine why she would want not to use what was prescribed?
Phenobarbital isn't particularly expensive. It's an older drug and a generic drug, and potassium bromide is coming down in price. Honestly, again, this is not very common. It probably would be better if she was looking for other options to consult maybe a veterinary neurologist. There's so many specialties now. But when you get into the less common diseases, I think it's important to seek out specialty advice if you want a more tailored diagnosis and treatment.
It's so interesting because, as you said earlier, these days we are treating animals, things that, cancer treatments that we think of are just for humans now are available for our pets. And I want to come back after I take this next caller and talk about insurance if you know something about it. So, John from Hollidaysburg, you are on the air. You're out there, John?
Yes, I am.
Hi, what's your question, please?
My question is, I have a Pomeranian who I adopted about a year ago, and he is supposedly 10 to 12 years of age. And what he does is hacks, and he hacks and hacks and hacks, and it really concerns me. But then he'll get okay, and he's playful, and I have a little long-haired Chihuahua, and the two of them just get along so terrifically. They're really pals. But I'm concerned about Happy Boy, I call him, who has this hacking.
All right,
and whether be treated or...
How long has he been doing it? Has he been doing it ever since you got him?
Yes, he has. It seems that sometimes it's worse than others, but it's not always.
And does he ever bring anything up when he's coughing, like a phlegm or mucus?
No, he never brings anything up. That's a surprise. It sounds like he's trying to, get some phlegm out of his throat.
Mm-hmm. Well, not seeing him, I can't really tell you, but I do know that smaller dogs are very prone to a syndrome called collapsing trachea. There are rings in your windpipe that hold it open. And what happens in these guys, the rings are a little soft. So when they get really excited and start breathing hard, the trachea collapses on itself and actually triggers a cough reflex. So these dogs tend to cough more when they're really excited and running around, especially if it's hot. And it seems to be worse if they're a little overweight because they have to work a little harder to breathe. This is
he's very thin.
He is very thin. Well, it may be that he does have that, and it would help to have him examined by a veterinarian to tell that. It's not a disease that is easily treated. It's managed medically. We'll often give them anti-inflammatories and things to open up the airways a little bit. There is a surgical procedure that's pretty sophisticated, and I'm not too sure it's something I would recommend unless the animal was really having trouble breathing. Anything yet?
No, I think that's often asymptomatic, and sometimes the veterinarian, if they examines it, they have a pretty good clue. Just a physical exam, they can sometimes trigger it with a little bit of pressure on that area. And so if you'd had the dog examined recently, they maybe help you diagnose if it is collapsing trachea or not.
Okay, all right.
And they could make them feel a lot better, too, with the medications.
All right, thanks for that phone call. If you're just joining us, I'm Patty Satalia, and this is Conversations Live, Ask the Veterinarians on WPSU TV and WPSU FM. Let me reintroduce our guest. Dr. Ellen Scholz practices at All Creatures Veterinary Care in Center Hall, where she treats cats and dogs as well as exotic pets. Dr. David Wolfgang is the Director of Field Investigations and an Extension Veterinarian in the Department of Veterinary and Biomedical Sciences at Penn State. Among other things, his work focuses on animal well-being and preventative health programs for livestock. Our number is 1-800-543-8242, and our panelists are ready to take your call. You can also email your question to connect@wpsu.org. If you'd like to join us on Twitter, you can tweet a question to @WPSU. I mentioned dog insurance a moment ago. Who ought to get it? How does it work? Anything you can tell us about pet insurance, Dr. Scholz?
Well, I do tell a lot of my clients, especially for new puppies and kittens, nowadays in veterinary medicine, we can pretty much do almost anything they can do in human medicine, including hip replacements and kidney transplants, in fact, in cats. But unfortunately, the limiting factor is economic, you know. So I think you have to decide as an owner, if you know you'd really want everything possible done for your pet, it's a really wise investment. And investing when they're young keeps the premiums down. Now, it is important, there's a number of different plans out there by different companies, and you want to make sure it's a reputable company, the program's been around for a while, and find out exactly what the premiums are and what the benefits will be.
And whether your vet takes insurance payments.
Well, most of these are like the old human insurance where you pay up front and they reimburse you. So.
Okay, the consumer.
Yeah, and sometimes people have to go for disaster insurance. So they sometimes will opt for, if my dog has a hit by a car or some major catastrophic injury, then sometimes that's more attractive for people, because that's often where we had a caller earlier, that's often where they get into trouble. I have a pet I love, but this is more than I can handle right now. And that insurance often is very helpful for that.
All right. We go now to Mary, who's calling us from Altoona. You're on the air, Mary.
Yes, doctor. Thank you for taking my call. I have a Shih Tzu Poodle mix. Actually, I had two brother siblings, and the little one I lost last year because he had sugar for 5 years. He was diagnosed with Cushing's. I thought it was his sugar and tried to get a handle on it for months, and it's probably my fault. I went to the vet, and I actually think he was too far gone, but they had put him on Lysadrine, and I really, really think that it was really too strong for him. He was the runt, so he was too little. And I lost him a year ago. And just 6 months ago, I still have his brother. He's a lot stronger than his brother was. But he was diagnosed with Cushing's, and they started him on Lysadrine back in March. I was very leery of the drug, but I had no choice. I know there were I had studied it a little bit. There were other drugs out there, but this one, I guess, would get a handle on it more than any. I think Veterol is a new drug. Just a month ago, he got they weren't happy with his Cushing's. It was in a level, I think, of 600. So they upped it to a pill and a quarter. He was taking 500 milligrams once a week. He had loading week, and then he takes one a week of 500 milligrams. And, he got deathly sick. And I rushed him. They had him on an antibiotic and fluids for 3 days. And he's fine. He is free of medicine. He has not had Lysadrine for going on 3 weeks now. But after 3 weeks, they said he's probably got to get on it again. But I guess what I'm asking is he has to be on something. Is that right?
Explain first what Cushing's is for those who don't know.
Well, you've been through a lot. I'm so sorry to have two dogs going through this. Cushing's disease is a relatively rare disease of people, but a relatively common disease of animals. And how old are your pups now?
I'll tell you what, he is 12.
He's 12, okay, so he is an older pup.
Yes.
Cushing's disease is an overproduction of the hormone cortisol, and cortisol is the hormone that cortisone and cortisone creams were derived from. In most cases, this hormone is secreted by the adrenal glands, which are small glands near the kidneys, and in most cases in dogs, there's a benign tumor, or there's a overproduction of the hormone because there's a benign or non-cancerous tumor in the pituitary gland in the brain, which is the master signaling gland, and it's telling the adrenals, make too much, make too much, make too much. Yeah. So the first thing we have to do, the diabetes is actually because of the Cushing's disease. All that cortisol makes their body resistant to the effects of insulin, so they become diabetic secondarily. Unfortunately, it's almost impossible to get the diabetes under control without controlling the Cushing's as well. Lysidrin is a drug that actually kills off part of the adrenal gland. And so even though this tumor in the brain is saying make more, the gland just can't make any more. Unfortunately, this gland also produces a number of very critical hormones for your well-being. And so it's a delicate balance of killing off just enough of the gland so they don't have symptoms of the disease and not killing off so much of the gland that the dog is sick because of lack of hormone production. And that's why it's very difficult, and there's a lot of follow-up testing to make sure you're right in that right balance. And that's a drug that's been used for years and years and years. The newer drug, trilostane, acts not to kill off the gland, but actually block the production of the cortisol, and it seems to be a little bit safer. It was just approved a couple years ago in the United States. It had been used in Europe for a number of years before that as well. And I do believe the price is coming down now that it's been approved, but it was really expensive, but I think a slightly safer drug. But you still, we're playing an incredible balance of killing just as much as we have to without killing the patient.
And I think her question too was her dog is going to need additional treatments if he's going to survive.
It's a lifelong diagnosis. Occasionally, depending on, as Dr. Scholz mentioned, occasionally there's on a younger dog, they might actually opt for surgery on some specific cases, and then that makes it a little bit easier to manage. But as she described, this is a hormone issue, constant production. It requires constant monitoring, and it is a very delicate balance between the proper therapeutic dose and healthy dog and an ongoing issue, and an aging dog at the same time.
And also because the hormone levels are changing, it's not like you're going to find the right dose and it's going to stay there. It changes over time. So it is constantly monitoring.
Well, that's a tough one. We go now to an email question. We have an email question from Carol. She writes, how can we gain control over excessive amount of barn cats? I've heard of oral contraception for them. These cats are not tame, and one dear friendly female has litters at least 2 times a year. I buy at least 16 pounds of cat food a week for feeding the cats that come down to eat on the back porch. Help, please. Maybe quit feeding.
The feral cat issue, I'll start, I'm sure Dr. Scholz has something. That's a very challenging issue because people mean well, but actually sometimes we foster the problem by feeding them. I certainly believe that there's a lot of issues involved in that, but certainly within certain closed colonies or certain small groups, if we can trap, and sometimes there is some help to do that, but to trap and neuter or trap and spay and put those animals back in the environment, they sort of have their colony and they're the king cat or queen cat, and they sort of keep the other cats at bay. But I certainly encourage her to try to get that animal spayed or neutered as much as we can to try to hold those populations down.
She mentioned the oral contraceptive. Is that something that's viable?
Nothing that I've heard of.
Yeah, it's very challenging, even in
I heard them talking about that in deer populations, and I don't know that it was ever even done. It was just talked about.
Well, it's theoretically possible. The problem is, can you get the right dose to the right animal?
And the males may be eating the contraceptive instead of the females.
It's extremely difficult.
Okay.
Deer are seasonal breeders, and so there's some issues there, but sometimes there are some opportunities because they have a season when you can block the hormones, but it's never been done at large scale to be practical.
Okay, so any advice in terms of how to trap a feral cat?
Well, first of all, I agree. This is a tremendous problem. If you took one male and one female cat and allow them to reproduce and their offspring to reproduce unchecked, by the end of 5 years, you have 44,000 cats. So that's the scope of the problem. And I agree with Dave. we always want to help and take care of these animals, but when you put out food, what you're doing is bringing all the animals together. You are also giving them enough nutrition to breed at maximum levels, so it is sort of fostering the problem. I do know in our area there's a group called the 100 Cats Foundation that does have a trap, neuter, release program.
They'll actually go out to the property.
They can help you, but you can also get the live traps that they have to catch these animals, and you put food in them and catch them, and then they will mark the animals either by nicking the tip of their ear or with a tattoo, so you know which ones have been spayed and neutered and which ones haven't. But it's a tough one because with all of these colonies, again, as you keep feeding them, new ones are going to come in. So it's going to be a never-ending problem, unfortunately.
All right, boy, that's a tough one, too. We go now to Francis, who's calling us from Johnstown. Francis, you're on the air.
Okay. I have a 90-year-old, he's like 94-year-old cat.
In cat years, we're assuming.
And now he's developed a bad itch around his neck, the back of his ears, and under his neck. I felt under there because he has a lot of hair, and I felt his little bumps the whole way around. I went to a veterinarian and bought some hydrocortisone.
And I need you to get to your question because that music indicates we're almost out of time. So can you just jump to the question?
I just wanted to know what's causing him to scratch so much.
Well, it does sound like possibly an allergy, but with an older cat, I'd also be concerned about cancers and other problems of the skin.
Okay, I'm sorry we couldn't answer that one effectively. We've just run out of time and lots of people still hanging on. Thank you to tonight's guest, Dr. Ellen Scholz, a veterinarian practicing at All Creatures Veterinary Care in Center Hall, Dr. David Wolfgang, Director of Field Investigations and an Extension Veterinarian at Penn State. Thank you for tuning in tonight. For all of us here at WPSU, have a good night.